I'm a medical retina specialist in ophthalmology. What that basically means is I deal with specialties for the back of the eye. So the retina and the vitreous, which is the gel structure in the back of the eye. So that can be anything from diabetic retinopathy to age-related macular degeneration, vitreous floaters, and multitude other things. I chose ophthalmology because in medical school I had the opportunity to work with an ophthalmologist in my second year, and just really liked everything about the experience, from the technology in the room to the way that he interacted with me as a patient. And I thought that was something I wanted to pursue, so I did some research in the field, and then I just started doing more clinical work and realized that for me, ophthalmology was a great blend of clinical experience and OR time. I think one of the benefits about ophthalmology operations is that for the most part, it's very fine, very detailed. We operate with microscopes, and there really isn't any blood to speak of. So compared to other surgical fields, I think that's a nice perk. Well, normally I would have a routine where I would go to the gym 3 times a week and go to the weight room and then play basketball. But COVID has changed that, and it's actually helped me to discover some new passions, which include cycling, and I'm just starting tennis now. So those are my 2 COVID activities. I think I've had a lot of exposure to all sorts of people by virtue of the fact that I've moved around a lot in my life, and so I think I can relate to patients quite easily, and I think patients appreciate that. So one of the most common feedbacks I get from patients is that they feel comfortable in the office with me, and that's something which I hope to continue to bring here to Rochester. Well, I was born in Europe, actually, in Romania, and I came over when I was young, at 7 years old, and lived mostly in the tri-state area. Rochester is pretty much home for me. I went to high school here and went to medical school at U of R, and then I went away for my training for residency and fellowship. Went to Long Island first, and then to Los Angeles. Then I moved to Philadelphia for my first job. After 8 years of being away from Rochester, I decided to come home because this is where my family is. This is where I want to develop my career and see patients. And so for me, this is almost like a coming home occasion.